What are the stages of periodontitis? Periodontitis is a progressive and more advanced stage of gum disease that involves deeper inflammation and damage to the supporting structures of the teeth, including the bone. The stages of periodontitis are often categorized based on the severity of the disease and the extent of tissue and bone loss. The American Academy of Periodontology, AAP, has outlined a classification system for periodontitis that includes several stages. Here are the main stages of periodontitis. Stage I, initial periodontitis, mild. Early signs of periodontal tissue destruction, including bone loss. Typically, there is minimal attachment loss, 1 to 2 mm, and pocket formation, 4 mm or less. May show signs of gum inflammation and bleeding upon probing. Often, there may not be significant clinical symptoms, and the condition can be reversible with appropriate treatment and improved oral hygiene practices. Stage II, moderate periodontitis. Moderate attachment loss, 3 to 4 mm, and pocket formation, 4 to 6 mm. Increasing bone loss may be evident on X-rays. Gingival recession and tooth mobility may become more noticeable. There is an increased risk of tooth loss without effective management. Stage III, severe periodontitis, advanced. Severe attachment loss, 5 mm or more, and pocket formation, 6 mm or more. Further progression of bone loss, potentially leading to significant tooth mobility. Tooth sensitivity to temperature changes may become more pronounced. Tooth loss becomes a greater concern, and treatment requires more intensive measures. Stage IV, refractory periodontitis. Characterized by ongoing severe periodontal breakdown despite appropriate treatment efforts. This stage may indicate the presence of underlying systemic factors or complex bacterial infections that contribute to the disease's progression. Stage V, necrotizing periodontal disease. This stage involves severe infection and tissue death, necrosis, in the periodontal tissues. Patients may experience painful oral ulcers, rapid tissue destruction, and bad breath. Necrotizing periodontal disease is often associated with other systemic health factors such as immunosuppression or malnutrition. It's important to note that the progression of periodontitis can vary from person to person, and not all individuals will experience the same stages or symptoms. Regular dental checkups and early intervention are key to preventing or managing periodontitis. Once periodontitis is diagnosed, a comprehensive treatment plan will be developed by a dental professional, which may include deep cleaning procedures, scaling and root planing, antibiotics, and in more severe cases, surgical interventions. Ongoing maintenance and improved oral hygiene practices are crucial to managing periodontitis and preventing further progression of the disease. What are the symptoms of periodontitis? Periodontitis is an advanced stage of gum disease that can cause a range of symptoms due to inflammation and damage to the gums and supporting structures of the teeth. These symptoms can vary in severity and may indicate the presence of periodontitis. If you experience any of the following symptoms, it's important to seek dental care for a proper evaluation and treatment. Common symptoms of periodontitis include 1. Gum recession. Gums may start to pull away from the teeth, causing the teeth to appear longer. This can lead to the exposure of the tooth roots. 2. Pocket formation. Pockets, or spaces, between the teeth and gums may develop as the gums pull away. These pockets can trap food particles and bacteria, contributing to infection and further inflammation. 3. Bleeding gums. Gums may bleed during brushing, flossing, or even spontaneously. This is a sign of inflammation and infection. 4. Bad breath. Persistent bad breath, also known as halitosis, can be caused by the presence of bacteria and infection in the oral cavity. 5. Gum sensitivity. Gums may become more sensitive to touch, temperature, and pressure. They might feel tender or sore. 6. Tooth mobility. As the supporting bone is compromised, teeth may become loose or shift in position. 7. Changes in bite. The way your teeth come together when you bite may change due to shifting teeth and bone loss. Pus and abscesses. Infection can lead to the formation of pus-filled pockets or abscesses, which can be painful and cause swelling. 8. Gum discoloration. Gums may take on a reddish or purplish hue due to inflammation. 9. Pain and discomfort. You might experience pain or discomfort while chewing, brushing, or flossing, especially as the disease progresses. 10. Exposed tooth roots. Receding gums can expose the roots of the teeth, making them more sensitive to hot and cold temperatures. 11. Changes in tooth alignment. Teeth that were once well aligned may start to shift or become misaligned due to the changes in the supporting bone and gum tissues. 12. Tooth loss. In severe cases, periodontitis can lead to tooth loss as the supporting structures weaken. It's important to note that the symptoms of periodontitis can vary from person to person, and not everyone may experience all of these symptoms. Additionally, in some cases, periodontitis may not cause noticeable pain or discomfort, especially in the early stages. Regular dental checkups are crucial for detecting and managing periodontal disease before it progresses to more severe stages. If you have concerns about your gum health or experience any of these symptoms, it's recommended to schedule an appointment with a dentist or periodontist for a thorough evaluation and appropriate treatment. What are the different types of periodontitis? Periodontitis is a term used to describe a group of inflammatory gum diseases that involve the progressive destruction of the supporting structures of the teeth, including the gums and bone. There are several different types of periodontitis, each with its own distinct characteristics and causes. Here are some of the main types of periodontitis. 1. Chronic periodontitis. This is the most common type of periodontitis and typically progresses slowly over time. It is characterized by inflammation of the gum tissues and progressive attachment loss, bone loss, around the teeth. Symptoms may include gum recession, pocket formation, and tooth mobility. Poor oral hygiene, genetic factors, and systemic health conditions can contribute to chronic periodontitis. 2. Aggressive periodontitis. Localized aggressive periodontitis. This type of periodontitis usually affects young individuals and is characterized by rapid attachment loss and bone destruction in specific areas of the mouth. It often occurs around first molars and incisors. Genetics and specific bacteria are thought to play a role. 3. Generalized aggressive periodontitis, similar to localized aggressive periodontitis, but affects more teeth and is often seen in older teenagers and young adults. 4. Necrotizing periodontal disease. This is a severe and often painful type of periodontitis, characterized by tissue necrosis, death, in the gums, periodontal ligament, and alveolar bone. It is often associated with factors such as smoking, stress, malnutrition, and immunosuppression. Symptoms may include ulcers, gum tissue sloughing, and severe bad breath. 5. Periodontitis as a manifestation of systemic diseases. Certain systemic diseases, such as diabetes, can exacerbate or contribute to periodontitis. The immune system's response to these diseases can affect the gums and supporting structures of the teeth. 6. Periodontitis associated with endodontic lesions. In some cases, periodontal infection can be associated with a tooth that has a chronic infection in the pulp, endodontic lesion. The infection can spread from the pulp to the surrounding gum tissues. 7. Acute periodontal abscess. This involves the sudden onset of a painful, localized abscess within the periodontal tissues. It can be caused by bacteria becoming trapped in a pocket between the tooth and gum. 8. Refractory periodontitis. Refractory periodontitis refers to cases where the disease does not respond as expected to standard periodontal treatments. This may be due to factors such as antibiotic resistance or underlying systemic issues. What are the causes, risk factors and prevention for periodontitis? Causes of periodontitis. Periodontitis is primarily caused by the buildup of bacterial plaque along the gum line and beneath the gums. Plaque contains bacteria that produce toxins that irritate and inflame the gum tissues. Over time, this inflammation can lead to the destruction of the supporting structures of the teeth, including the gums and bone. Poor oral hygiene, which allows plaque to accumulate, is the main cause of periodontitis. However, there are other factors that can contribute to its development. Risk factors for periodontitis. Several factors can increase the risk of developing periodontitis. 1. Poor oral hygiene. Inadequate brushing, flossing, and regular dental checkups allow plaque to accumulate and contribute to gum disease. 2. Smoking and tobacco use. Smoking weakens the immune system and reduces blood flow to the gums, making it harder for the body to fight infections. 3. Diabetes. Uncontrolled diabetes can impair the body's ability to fight infections, including gum infections. 4. Certain medications. Some medications, such as antihypertensives and anticonvulsants, can cause dry mouth, reducing saliva flow and increasing the risk of gum disease. 5. Genetics. Some individuals may be genetically predisposed to gum disease. 6. Hormonal changes. Hormonal fluctuations during pregnancy, menstruation, and menopause can make gums more sensitive and susceptible to gum disease. 7. Certain medical conditions that weaken the immune system, such as HIV/AIDS, cancer, and autoimmune disorders, can increase the risk of gum disease. 8. Age. Older adults are more susceptible to gum disease due to natural wear and tear on the gums and supporting structures. 9. Poor nutrition. A diet lacking in essential nutrients can weaken the immune system and compromise gum health. 10. Stress. Chronic stress can affect the body's immune response and increase the risk of gum disease. Prevention of periodontitis. Preventing periodontitis involves maintaining good oral hygiene practices and addressing risk factors. 1. Regular oral hygiene. Brush your teeth at least twice a day and floss daily to remove plaque and bacteria from teeth and gums. 2. Regular dental checkups. Schedule regular visits to the dentist for professional cleanings and checkups. 3. Healthy lifestyle. Avoid smoking and tobacco use, and maintain a balanced diet rich in vitamins and minerals. 4. Control diabetes. If you have diabetes, work with your healthcare provider to manage your blood sugar levels. 5. Medication review. Discuss potential side effects of medications with your healthcare provider, and if necessary, your dentist. 6. Stress management. Practice stress reduction techniques, such as exercise, meditation, and relaxation. 7. Prompt treatment. Address any gum inflammation or bleeding promptly and seek treatment if needed. By practicing good oral hygiene, addressing risk factors, and seeking timely dental care, you can significantly reduce the risk of developing periodontitis and maintain healthy gums and teeth. If you have concerns about periodontitis or your gum health, consult a dentist or periodontist for guidance and appropriate care.